an addiction starts with someone, does that now put the persons that will come from them at risk?
Now, I tell parents, if you have to use, don't send your child to go and buy for you. Must you send your child? These are environmental factors. These are things that will actually increase their risk of using.
How has your perception or your understanding of addiction changed across the years?
Addiction hijacks the judgment seat in the brain.
Yes.
So my own question is, if grass is what has taken over your judgment seat, you can imagine what type of decisions you'll be making. It will be like lower animal. I work at the Federal Neuropsychiatric Hospital, Yaba, Lagos. Yaba is a 600-bedded hospital. I work on a 90-bedded addiction unit ward. Always filled up with a long waiting list. Very long waiting list. I have seen several patients that said it was when this organization came to our school, they were showing us cannabis, they were showing us this. That was when I decided I'm going to use. Everybody that feels that I'm into prevention, sometimes they bring more harm.
Welcome once again to another edition of Beyond Addiction. My name has not changed. I'm still your host, Amadin Ogbewe. As always, I'm joined by my co-host, Dr. Hope of VIGADA. I have a very special guest in the house today and a very special episode, so to speak. We want to talk about digitizing recovery. And the conversation promises to be a very interesting one. Our guest is Dr. Olajumoke Koyejo. She's a doctor, psychiatrist. She's also the president of the Nigerian chapter of ISSUP. And she joins us now to do justice to this matter. Welcome.
Thank you very much.
Good to have you.
Yeah, thank you.
All right. First of all, we should say that it's one of the reasons, especially because you're not usually in our vicinity. So this is a rare occurrence to have you here. In fact, you have to leave just after this. So let's go straight into it. As a psychiatrist, your years as doing the work and then becoming the president of ISSUP, there's a common saying that's attributed to you, which I believe is common in the field, but it's also attributed to you about how addiction is not a moral feeling. So I just want to know, in those years leading up to now, how has your perception or your understanding of addiction changed across the year to now?
Okay, thank you very much. Well, addiction is both behavioral and chemical. Behavioral means the gambling, screen addiction, and the rest like that. Then psychoactive substance, that's cannabis, all those other things. Well, over the years, initially when it started, I think that was 2003 or 2004, I felt, I knew it wasn't a moral thing. But over the years, I've learned to actually appreciate people with addiction and respect them. Well, my own description of people with addiction is we all send our children to school to study. They are being trained to think out of the box. And this set of people are very brilliant people. My patients that I love so much, they are very brilliant people thinking out of the box. So mistakenly, not by design, when something use that energy negatively, and that's how I see my patient. So over the years, I've learned to appreciate the good side of my patients, and I believe strongly, if we help them go back to that right path with all the energy they have, with the level of innovative spirit they have, this world will be a very great place to live in.
Just a quick follow-up. There's a popular American actor, Ben Affleck, who had issues with addiction. Recently on the podcast, he said that he doesn't believe in these fancy solutions. People say go to rehab. He doesn't believe in it. That what he believes is the only cure for addiction is suffering. And one day you suffer enough and you say, I can't continue. What do you have to say about such a statement?
That's very wrong, totally wrong. And in fact, I don't want anybody to repeat that. They are sick, and there are people. You don't treat diabetes or hypertension with suffering. It's a science, and there are stated evidence-based ways of treating addiction. That's the way to go. Well, that might be, people have anecdotal experiences, and that might be his own way, but doesn't make it right. The fact that it worked for only one person out of 300 million does not make it right. So for me, that is not evidence-based, and that is not the way to go as of today, 5th of August, 2026.
Yeah, I'll call you chief, because in the medical profession we call our seniors chief. So,
thank you very much.
Yeah, so chief, you mentioned that people who suffer addiction do not necessarily do so out of design.
No.
But I want to cross that with evidences emerging with respect to genetic predisposition to drug addiction, and having parents who had suffered drug addiction. And unfortunately, some of my clients even had their parents suffer addiction and committed suicide, and they now even fear that they may go in that line. And like I said, there may be evidence emerging that there are some genetic predisposition to why some persons may be predisposed to having an addiction, because not everybody who abuses substance eventually becomes, suffers an addiction from that particular substance. By research, about 10 to 15% of individuals who use a substance may have a problem, with, discontinuing the use of that substance. Now, so how do we put that together in understanding this? Yeah.
Okay.
In terms of design, and those who may also be prone to developing mental illnesses like depression, that's chemical substances, the hormones, might be low or high in their brain to predispose to some behavioral abnormalities, and this can be risk factors to use of substances too. So how do we put that together?
Okay, thank you very much. Yes. Well, you talked about what was the question? First question.
Genetic disposition.
Predisposition. Yeah. Okay. The first question tells some people that they are prone to. Nobody plans to get addicted. That is a standard. All my patients that are on that ward, and they are everywhere that I have not seen, they never plan to have a disorder. It was just, most people start with a recreational thing, or even to medicate some form of illness or the other, and that's how it started, and they found themselves there. And let me tell you this: nobody, like I told you, nobody plans to become to get to the level of dependence. And I think the fact that someone is genetically predisposed does not mean you are equal to having it. Most people are genetically predisposed to being overweight, genetically predisposed to being hypertensive, genetically predisposed to become diabetic, and they never become. I'm sure it has a blueprint in our gene, and I'm sure if you go and check the number of illnesses and diseases we are genetically predisposed to, one will just faint.
There are no environmental factors.
Yeah, of course. There are several factors that work together to actually bring out this disorder in people. And I will tell you that there are some people that down their street, there's a big bunk there, and they won't still use. So there's no one way that we say, okay, because they are genetically predisposed. Yes, of course, when you are genetically predisposed, that means you should be more careful than others. If you have a family history of hypertension, that means you be very, very careful, much more than others. But it doesn't mean it is equal to my patient or anybody getting that illness. So I really feel that, like I said, nobody plans to get there. It started, and even if you are genetically predisposed, of course, the more reason why you should be careful.
Absolutely.
That is it.
Exactly.
Even to mental illness, the more reason why you should be more careful than others, because you have a family history of one illness or the other.
So the more reason why we should be careful.
Yeah. But when we talk about this, we're always thinking about the parents, talk about the people before you. I'm wondering, if an addiction starts with someone, does that now endanger or put the persons that will come from them at risk?
Well,
I'm wondering if something to consider.
There's a genetic, there's genetic predisposition. And of course, it's not all the genetic loading in you that you pass across to your children. So sometimes, of course, it might not be equal to, but at least if there's a family history, we're like, okay, there's this level of predisposition. And you know that it's not just about the genetic predisposition, environmental factors. Because the parents let's assume the parents and that means the environment that child grows up into actually predisposes the person. The genetic loading predisposes the person. So there are two things now in that person. But with knowledge and information that's everywhere. So like now, I tell parents, if you have to use, please don't use in front of your children. If you have to use, don't send your child to go and buy for you. Must you send your child? So because these are environmental factors. These are things that will actually increase their risk of starting. And of course, other factors will reinforce continuing, and at the end of the day, they become dependent on these substances. So,
Chief, that's like harm reduction. So Chief is not saying parents should use.
They should not use.
Please reduce the harm on your children.
Yes, please reduce.
And I think one of the questions, what might be in Amadim's mind while he's asking is there's this concept of epigenetics, where there may not be a particular predisposition in a family line now, but because of an exposure to a substance, it could be radiation and it could be a substance of abuse. Now, those substances can now have the capacity to change or mutate the genetic makeup of that individual and can now be passed down to the next line of generation coming. So in epigenetics. So I think that's what he may also be looking at. So does that really also affect? Well, like Chief said, in as much as we have genetic predisposition to these things, right, there are other factors, which is why they are called risk factors.
Yeah.
Right, there are other factors that can come to play a role. And in fact, in genetics, they are recessive and dominant. That means a parent can have a particular genetic gene, but will not manifest in the next child in line. Doesn't mean that the person doesn't have that gene. It may now show. Okay, someone asked a question 2 days ago. He said, is it possible for 2 parents who are not albinos to give birth to an albino child? I said, ask the parent, either the grandparent. So it's possible, yes, the gene can be recessive in this current parent.
And be dominant in the next generation.
Yes. Yeah, so.
But I'm happy that there's a lot of context, because some random person can say, you see, the reason I abuse is because one of my great grandfathers back then.
No.
There are factors that play a role. Don't take that as an excuse.
So one thing I also want to point out is, and because of our conversation, one issue we always come up with is the issue of statistics. Whenever I want to go statistics, we have to go back to 2018 or thereabouts.
2010 UNODC.
Yes, it's very popular. So, but as someone who has also published research, who's been in the business, what could you tell us about the current state of things, if any, from some of the research you've carried out? And is there anything that sticks out that you really want people to know that maybe is not obvious at the moment, especially for people keep quoting 2018?
Well, okay. For a research to be published in 2018, it had been done earlier. So you could, I think that research, I don't know how many years they used to collect the data for that research, for them to polish it, to analyze and everything, and eventually published 2018. So it must have been maybe even 2012, 2013, that was when they started the data collection. So, let me say this. I work at the Federal Neuropsychiatric Hospital, Yaba, Lagos. And when there's this study that we've known in Yaba that Yaba is a 600-bedded hospital. I work on a 90-bedded addiction unit ward. 60-bedded male, 30-bedded female.
Wow.
Always filled up. There's a long waiting list. 40 to 60% of our patients have substance use disorder or one form of addiction or the other. So, that means, I don't know, do the calculation. And there's always a waiting list, a very long waiting list. So now, the 2018 data is for the general populace. So if I will most likely have any data to be clinic based, and there's no people that are sick that would come. There'll be over reporting. Over reporting because I see people that are sick.
Okay, I understand.
So there'll be more people coming to me. But what I've noticed is that, I might not have the rate at which we have about cannabis and cannabinoid substance. This synthetic cannabis has increased. Methamphetamine and amphetamine-like substances, they've increased so much. So these are just the few things I could say. But I believe that by now, the data would have, the prevalence would have increased because of the things, we see more different things now, and the rate at which it's even becoming acceptable, availability, accessibility is so high. So I believe that that prevalence is not the true prevalence now. As of today, it would have increased, most likely.
What would it take to get that level of publication again to actually know what's happening?
It was a nationwide study, and I think it was sponsored by European Union, something that UNODC had So it's like another data involving the whole country, and that might take like another 5 years. So if you want to report today's, let's assume today's data now, and before we collect for the whole country, so that's 2020 plus 5.
Yeah.
2031.
2031.
So you can imagine. So it's not something that you do often, but 2018 till date is a long time. 10 years with 2028. I think we should be working towards. I think there's another study on the way now that's going to for another nationwide study of prevalence of addiction now. In the country.
For Dr. Kwame, I don't want to comment. You when you mentioned the bed space, if I heard correctly, what was that ratio of men to women?
Oh, there are more. I think there are more men. There are more bed spaces for men than women. But the point is then, the design. Okay, okay, let me talk about my own ward. A 60-bedded male, 30-bedded female. The male ward is always filled. Always.
What about the female?
Well, sometimes we have few beds that are not filled, but the male ward is always filled, and their own waiting list is a long waiting list out there.
So what's happening to people on the waiting list who can't, at the moment, access care?
Outpatient care.
What does that entail?
That means you take a medication, you come for treatment for
you just
psychological.
have to be monitored in person.
Yes, in person on the ward.
Yeah, Chief, talking about the numbers, and we want to put it out that these are not just figures. These are human beings.
Yeah.
These are human beings. Chief is a very passionate speaker and advocate on this issue. And then, of course, one thing that also stands out for me in what she has said again is the fact that none of her patients plan to suffer addiction. So, you see, many young people out there who probably are being wooed to use substance, they need to understand that nobody today who suffers an addiction plans to. So, in as much as they are not planning to suffer addiction, is more reason again why they shouldn't even start, because it's not something that is within their plan threshold. No, please.
It's smart. Don't start.
Don't start because nobody plan to suffer addiction.
Yeah. So, but what would you say about your efforts then? If you feel the numbers are increasing, one might wonder, you are in this field and you're trying to solve this problem. But you also have the mindset that perhaps it's increasing. What do you say about the efforts being made and, why, if it is not yielding the results that we want, what's the issue there?
Okay, well, the effort is, we need multidisciplinary approach to solve the problem of addiction. And that's just from one angle. Okay, let me tell you something else. I was telling someone yesterday that collaboration, we should all collaborate. And there's so much energy out there. The question is, are they evidence-based energy? Are they not doing more damage than good? Like everybody that feels that I'm into prevention, sometimes they're doing more harm. I have seen several patients that said it was when this organization came to our school, they were showing us cannabis, they were showing us this. That was when I decided I'm going to use. It was when they brought this person that he said I'd used before. Now I'm well. That was when I said, look, okay, if you are this good, let me use and I'll become like you. So you can, and the idea was we are going to the school to do prevention. Now they have even lured some other people into it. So there are several activities that we do that are not evidence-based. Then another thing is not just about one organization working, it's about collaboration. Okay, I was telling someone, maybe I should use this, that look, addiction professionals, we should even move, is it federal revenue tax people that determine tax people would pay. Now we should go and educate them that they should increase tax across board on all licit psychoactive substances. Of course, you know what those licit ones are. And I was like, you
can let know yours now.
Alcohol and all those things. They should times 500%. Look at it. And I said, and the person that I was
Chief, they will come for you. No, not us.
and she was like, Dr. Koyejo, do you mean it? I said, yes. That's so to be less available and less accessible. So if you have to start, if you want to use, it wouldn't be something that a secondary school can just go in and buy anymore. So you can imagine. So even it's not just about doctors. You can imagine the parts those people can play. Government policies generally, they are extremely important. Supply reduction. Of course, NDLEA is doing so much well now. And what are the other things we should do about the Ministry of Education? Life skill training. You know, knowledge does not lead to behavioral change.
That's it.
What does?
Teaching them skills, how to utilize the knowledge, life skills. Teaching. You can imagine teaching your 5-year-old in school assertiveness training, coping skills, critical decision-making skills,
problem-solving skills.
So when he sees this person showing me, he knows that how do I look at it critically and make my own decision? That even if daddy is using, I've been told and I've read and I have enough information that I should not use because my father is using. You know, those are the type of things you're not showing them anything. You're just teaching them life skills, and it will translate into prevention. So if all these organizations, so it's a lot of collaboration that we have to do, and that is when we'll be seeing significant reduction. Accessibility of availability. You know, I was talking about pharmaceuticals, and somebody asked this question: that do I think pharmaceutical agencies are not doing well enough? That somebody said, and I should comment. If you say they should reduce like tramadol now, you see 250 milligram. And pharmacy said 250 milligram is not from them. Now it's just 50 milligrams. How come they are everywhere? Said they're not empowered enough to stop them. That any Tom, Dick, and Harry in this country can import medication. So it is not just about we are doing. ISSUP Nigeria is working so hard. What about all other agencies that we should come together to do this fight? To direct all agencies that are directly involved and indirectly involved. How about journalists? Responsible journalism. No, for some people, it's just about sensationalize
the story.
The stories.
Yes.
And in that way, they actually introduce substance to people.
And even probably increase the stigma around the substance use.
You're getting it. So people that are even sick, they don't want to seek help. And that's where the idea of VIBECHECK comes in. That it's a free, anonymous, confidential screening tool. And it even show you the pathway to care. So now in the corner of your room, if you have the link to that app, you just assess yourself and you can make your informed decision. And there are even phone numbers there that you can call. So it's we really have to work together, not in silos. And that's when we start seeing the difference.
I think the alarming part for me is that someone actually trying to do good may be causing harm. Just a quick one, when we had the NDLEA media director here, an advocacy, he said that sometimes they don't expose some of the information about maybe the profits or the amount that these dealers are making, because even though you are showing somebody, look, this person has been jailed for this amount of years, and you expect that there's a fear that he was into drug dealing, now he's in jail. No, he was into drug dealing. He made so billions. He's in jail, but his money is somewhere.
Waiting for him.
So parading a suspect or a convict is now even leading to encouragement. People are motivated to do that. And I wonder how we can then always ensure that we are not causing harm, even when we have good intentions.
You know, what we are discussing, what Chief is also hinting at, is the fact that some of our activities and programs channeled at advocacy on drug addiction, abuse, and mental health are actually not evidence-based. And we're not saying they are not efforts. But what is the efficiency?
Of this effort.
Yeah, because the UN, some of the trainings we have had, with DPT and all, you will see some of the activities do not have the same efficiency in terms of impact. Now, which was why I think 3 years ago, some organizations in one state, I don't want to mention the name, they were writing to VIGA that, we want to partner with you, basically come and fund us. The first thing I did, because every beauty pageant want to go to secondary school and talk about drug addiction. I hope they don't come from me. Anyone who has, it's my birthday today, what can I do to impact the world? It's good to be an impact to the world. But then they are talking about drug abuse, drug addiction to children, who are even further, triggered or more curious to want to use because they have gotten information that wants them to, try out what you are saying. And sometimes the right messaging matters, what not to say. So I think the first thing is people who are interested in some of these things should consider even training by ISSUP, for instance, so that they can have the right training to carry out this work they are so passionate about. Because sometimes this passion that is good, becomes counterproductive to the impact you want to even make.
You have the passion, but you have the capacity.
You don't have the capacity. So while ISSUP is, I think, I know ISSUP do trainings, to see.
There are several evidence-based trainings, seriously. And if you want to do something, be trained. There's this Mrs. Ndidi, the head of service, civil service, said there's no substitution to capacity building. And I've told you it is science and a art. So if I can speak very well, I am of age, I can talk. That is not science. Go and learn something. And if you so much desire, speak to experts to help you out. They are everywhere if you so much desire, and they will do it the right way. And that's and the result you get. So it's we need to be very careful so that we won't just be busy doing nothing.
Indeed.
Or even busy doing evil.
That's worse.
I don't know if you've noticed that. I've noticed among my patients, let's assume somebody is age 45 and started using at age 18. Have you noticed that the decision-making skill is as if it stopped at that age 18? Or if I've seen a 65-year-old person that the sister was telling me that, look, is it possible for the brain to stop growing? That because this guy started around age 21, and the way he talks is like somebody of age 21. And I said, look, I've noticed it too. I've not seen any study to prove that it's as if they stopped learning decision making. They stopped acquiring those skills over the years because they can't even, because they're not using it. And there's this theory this hypothesis I gave it. Every day, those challenges they are running away from, and they use drugs, they are the things that are meant to develop the brain.
That's true.
So if you stopped running away from solving basic life challenges at age, let's say 18 or 20, your brain stops growing at that level, and you'll be finding solace in drugs. So even if you now say, I want to quit, you still have a lot of catch-up to do.
That's true.
I don't know if you've noticed that.
That's very correct, Chief. That's very correct.
I've just noticed it across board, and every day I keep telling people, please join me in let's keep noting this. That just remove that number of years they've used from their years in life and notice the decision they make, type of things they ask you.
Yes.
So if we want to grow muscle, now if you want to grow this your muscle, I'm sure you were doing those energy press-ups and exercise. So the brain exercise is to solve challenges, is to solve problems and prefer solutions. But if you now escape, brain stops growing. So you now have to be teaching them decision-making skill.
Does it?
But they'll tell you that I'm 65, Dr. I'm 45 years old, my Dr. You can't be teaching me something. But seriously, you've stopped learning since you were age 20.
It reminds me of a story I once heard of. A lady whose sister was kidnapped, and the fiancé or husband, in a bid to help the wife or his woman, proffered drugs for her. And, someone caught them, and he told the lady, he said, whatever happens, whether your sister lives, dies, is rescued or not, you will feel immense regret that you were not present. Because what the drugs will do for you is to take you away. And whatever happens, you are no longer really present. You don't know what happened. And
you process it.
Yes. And when your eyes become clear, I missed this. And, it would have been a moment you might have grown emotionally, you may have grown in the brain and all of that, but you ran away, so to speak, and you took an easy route out. And at the end of the day, it's worse off for you. Just so we can move the conversation along, if you can really tell us about ISSUP Nigeria, you've been talking about evidence-based. So what does that really mean? How does ISSUP measure it so that we can move on to VIBECHECK and the other things you talked about?
Well, ISSUP is International Society of Substance Use Prevention Professional. And the Nigerian chapter comprises of addiction professionals across the world. So it's not just an association of psychiatrists, an association of mental health, addiction nurses. attention of every one of us now, all coming together to form a group. And of course, our goal is into capacity building, to promote evidence-based capacity building, evidence-based prevention, treatment, research, and advocacy. And that's where we are part of the global ISSUP global, over 50-something thousand in over 200 countries. So the Nigeria chapter is,
should that ecosystem exist in this country? Because some people are not aware.
No, of course it does. And, that is why we need the collaboration. I keep telling people that, look, we can't achieve... I went to a meeting yesterday and I was telling the DG that the dream of ISSUP Nigeria, this present school, is beyond us. And we can't just achieve it on our own. We need collaboration. So when I tell people about this association, they're like, I thought, yes, there's an association like that. And everything you need in the field from policy makers to everybody, peer educators. Peer educators are people that have used and are now in recovery, and they have gone through training, and they are peer educators. They are in this association. So it's not just about professors only. Of course, they are professors of addiction psychiatry, there are professors of psychology, clinical psychology, and the rest. All of us, we are now together, trying to work together. Because I'll talk from my own clinical point of view. Someone that's a peer educator, look, Dr. Koyejo, this is what happens in the bank. And every day we are learning. You'll be shocked that there's so much I don't know. Let me tell you this story. There was these people that took me to... There's this place called Ojuno. No, it wasn't Ojuno. It was Akala in Lagos. Akala is somewhere in Mushin. And they were like, they are told, it was even a church. They were like, they are told this church would have a church right inside the bunk. I mean, they're the streets right in front of them.
When you say bunk,
that's a drug den where they use. Right. So they have told them that they are bringing an expert to talk to them, and of course I was feeling I'm an expert. Of course I am, but let me tell you the story. So when we're now going, at a point I was like, where are we going to? Say we are going to Akala now. I was like, it was getting dangerous for me, I must tell you. So when they on my way, I also saw them, the way you do rice or beans, the way, our parents when you are picking. So there was this big tray that had dry cannabis all over, and everybody was trying to pick. It was a big one for me. I was like, what? So cannabis can be this opened, and it was everywhere on the street, and you could see flame like. So they were like, so they now drove me to the place where they had the church. Said I should get down. Like, I can't get down. Like, okay, these people are expecting you are the expert, and we had told them. I was so afraid. So that means in the clinic and some other places and in research, I'm an expert. But in this place, forget it. I was so afraid.
You saw signs and wonders.
That's the word. Signs and wonders. Yeah. In fact, there was this woman that was breastfeeding, and I was smoking one big joint like this. And all of them, they're in the church. Like,
waiting for you.
Waiting for me. So now imagine someone that's gone through that route in recovery, now a peer educator. In that particular outreach thing, it'll probably be my boss.
More experience.
More experience. So we are all together now trying to help the society. And because we have this knowledge, we are all together, we know that we can't work in silos. We have to collaborate.
Okay. All right. So let's quickly move to VIBECHECK. That's like really the core of the conversation today. Digitizing recovery. What led to that? And what is VIBECHECK for those who don't know?
Let me start with what led to that. On the 10th of October 2025, this executive of ISSUP resumed office. And I work on the ward, and the people I see are just young, vibrant, brilliant young men. I'm always proud of them. They're like, look, and sometimes when they are talking, believe me, I don't understand all the slangs. So I will have to you mean, so that it doesn't look like, but of course I know the principle, I know the, but so I know that. And when the younger doctors, I'm young, very young, and the younger person is talking to them, you can see them, they're always rolling, and the guy will be right, and I'm like, okay, so what did you say? So and that there's a generational gap, there's this demographic gap, age gap. So when I became, and I knew that there are more people on the streets that are out there that shouldn't even come to our ward. There are several people that are experimenters out there, and we should catch them. We don't have to wait. I don't have to wait in my office and be waiting for them to get to the level of now struggling to see me. It's not so. That's not the way to go. So it came to my mind. Okay, what can we do to help them? And I know the way to help them is their phone, is their digital devices. And I told you collaboration. So when I was like looking at collaboration anywhere, everywhere. So I just walked into NICOMSAT, Nigerian Communication Satellite Agency. Mrs. Jane Egerton Ide, big shout out to her. So we started talking. I'm like, look, this is and this was around December 2025. Like, look, I'm looking for something that the youths that will be on digital device. Just speaking like a layman to her, she's like, look, Dr. Koyejo, that thing in your head, do you know that we can do it? Was like, what? She said yes. Because I was actually inviting her to the webinar. We have this global webinar that we do, telling her that, look, if you come, the last one we had participants from over something countries. We're like, look, no, I won't just come there and talk. I like the solution, I don't like just talking like every other person. That was how we started. So that was how we said, okay, we can have a digital tool. So on this digital tool, there's ASSIST, alcohol and substance use screening test. There's another tool to screen for gambling. There's another tool to internal DUNODC, internal and external trigger questionnaire. So you know your triggers. All of this validated instruments, we brought them together, and she just helped us digitize it. So, and how do we go about it? Okay, so now it is free, anonymous, and what else? Confidential, evidence-based. That's how. So on 12th of March 2026, she unveiled VIBECHECK. Mrs. Jane Egerton Ide.
So what is it for? I'm a young person. I don't think I have any substance issue.
Yeah, but you could have screen addiction.
Yeah.
Okay, so it's a holistic app for
all forms
of addiction.
Yes. And there's even a referral pathway, and there's a phone number. So and you can actually, it's a chatbot, so you can actually ask the AI to what next? What should I do? What do you advise that I do? And to give you at least, it's not a substitute to seeing a clinician, to seeing a professional, but a screening tool.
Very correct.
And it will tell you that you are at risk. See a clinician at this level. You're okay. You have very mild to moderate risk. These are your triggers. If you can avoid them, it will be of help to you. And you can actually go back over and over and actually check yourself whether you're getting better or not. And this is a tool that ISSUP Nigeria is presenting to the whole world, presenting to Nigerians. Look, you don't have to wait to see a professional. Just assess yourself and know whether you are getting to a dangerous level or not. And it will help you assess your triggers. So and you're not talking to me, so you should be truthful to yourself. And that is the whole essence of this VIBECHECK.
So what would you say has been the response? What you've been able to...
Yeah, of course. People are, at the back end, there's this... the more we talk about it, the more we go everywhere, people, there's increased use. And of course, we're even taking it a step further now. We want to validate it. So we're going to go through serious scientific research because these were pencil and paper questionnaires that we are translating. And we should, because I told you, we are scientists, we are evidence-based people. We won't just leave it at that because it was made for pencil and paper. Let's now validate it as a digital tool. Is it still doing what we want it to do? And so we will keep upgrading. It's a scalable tool. And so this is what we brought together and given to everybody, all students, everybody that has internet
connection.
Yeah, can use it at any point, at any time, moment, it's available once you have the link. And we're ready to provide the link for everybody. And that's the whole essence of the VIBECHECK. It's 8:00 in ISSUP Nigeria.
That's very correct. I see the youth-driven approach that you are giving to, the organization, especially in reaching the people who are possibly the most affected in Nigeria by this drug menace. Now, I'm also going to ask, because for instance, we have established that some mental health challenges, could predispose, or serve as risk factors to use of substances. So you mentioned, for instance, the assist with a psychological structured questionnaire, psychological test tools, used to assess individuals, on some of these levels. I also suggest if we can have more screening tools like the DAS, depression, anxiety, scale and all that.
There's this tool on PHQ.
Okay.
On it, which assess for mental illness. So it's a tool that it's not just about addiction. I'm an addiction psychiatrist, so I will always treat. Most times my patients have co-occurring problems. So there's a tool that screens for mental disorder on this same.
So if you're watching us, VIBECHECK is not just for those who you think is gone colos. Right? You can actually use VIBECHECK to, assess if you're feeling that low mood, those high moods sometimes, you may just take a break and check VIBECHECK. Check your vibe on VIBECHECK. Right? So check your vibe on VIBECHECK, right?
Serious.
The name actually, I think it's very fitting. So I wonder if I could go on VIBECHECK because I'm suspecting substance abuse and end up discovering I have a screen addiction.
Exactly.
Yeah, because it's an addiction thing. Addiction is not just about drugs anymore.
Exactly.
It's behavioral addiction. It is important we start thinking addiction, not just substance. We should think behavioral. Do you know the number of people that are into betting?
Gambling addiction.
Serious.
It's a lot. It's a lot, man.
I've had to treat religious leaders because they have gambling. You can gamble on your phone now. You can do all sorts of things. It's like this World Cup. I forget. My patient went all out. I'm like, okay, you're waiting. But I love my patients.
You can tell.
I love it. When you're talking to my patients on the way, like, what? This is what you're thinking? And I'm not even thinking like that. So I'll be like asking, why? What motivates you? That I don't know now. I'm like, okay, I enjoy talking to them. I must confess. Because they're just out of this world.
Mama, how do you balance? Because gambling in Nigeria is also a legal practice. We even have a lottery commission. So how do you balance that? Gambling addiction, gambling itself, and of course agencies that are mandated to oversee gambling.
You can just give us a snippet. Maybe gambling addiction is our for next season. A little bit.
I told you it's about collaboration. That type of agency now, I'm going to write to them. Let's talk. There's some things that are legal and I can't declare them illegal. Sometimes they say, Koyejo, we want us to stop all the vices on this side. I said, look, I don't know. But the point is responsible gambling.
Okay. There's something like responsible gambling.
Yes. Okay. Maybe there should be an age limit that you cannot do it. The earlier you start, the worse the prognosis. So maybe if you start at age 30 now, you'll probably be able to control what you do. But anybody that starts like age 13, what addiction does is that it hijacks the brain. That is just my own way of it. It hijacks the frontal lobe, the decision-making skill.
Yeah.
And so if weed that is, you're meant to be higher than, controls you. You can imagine the type of decision that will come from grass, that will come from weed, That's just it. So like that.
Can you take that again? If the grass, the weed, that are supposed to be higher than controls you, Chief.
Okay,
I think they need to hear that. Again.
Like I said, addiction hijacks the judgment seats in the brain.
Yes.
That is what addiction does. So they are always thinking about it. They will neglect other forms of pleasure. It's in charge. So my own question is, if grass is what has taken over your judgment seat, you can imagine what type of decisions you'll be making. It will be like lower animal. That is what it is. And I explain it to them every day. It's like you are allowing, no, I'm not that daft. Why would you say that? Why would you say that? I said, look, okay, let's analyze it. Did you use your school fees? You stole your parents. You stole a cow of what? 20 million. You sold it for 2 million. What do you think is in charge? Now that you've been off drug for a while, tell me, are you the one that made that decision?
Yes. You swapped a Rolex watch for a gram of something.
There are people who actively look for persons with substance abuse issues
To buy.
so they can acquire.
Yes.
That's true.
In fact, somebody, what made that decision? So if you can tell me what made that decision, we'll continue the conversation.
The thing you said about age, and I just want to quickly put that out there. I once saw a video of a young man. He was, holding the phone, crying and running. And he said, he mentioned the bet company's name. He said, I bet 10,000 naira, I lost it. You collected it. I bet 20, you collected it. Now I've won 1 million, 10 million naira. You say I'm underage. I wasn't underage when I was losing. Now that I won, you remember the law. But anyway, I just want to talk about youth. The youth o'clock you mentioned. What do you think youth leadership looks like, particularly within ISSUP Nigeria? And this, okay, Dr. Obse, we shouldn't call it war anymore.
It's not war against drug abuse.
Against substance abuse.
What's
the youth? How do you see youth leadership playing a role or evolving?
They are the people we should empower to do this work. I'm telling you. I told you that on my ward, when the residents are talking and they are speaking with the patient, you can see them. You can see them on talking better, and I'm like, just keep quiet, I'll be looking. What is this? What is this? Like, I don't know. This is what they said. This is what the patient said. This is what the patient said. Sometimes the language I don't even understand. So I'm like, you mean so that's to explain what you mean.
That's why I dress like this too.
You mean so now imagine this young person now has capacity, evidence-based knowledge. We're able to the conversation would definitely be better. So they won't see one Dr. Koyejo has come now. Let everybody sit down. Let's pretend we are fine. That won't be the case now. It's like our own has come. Our own has come. So they would even say much more than you were even expecting them to say. And I believe that they are better persons to reach themselves. They know the device to where to talk and where to meet themselves. So I can't put myself in those positions.
I should also commend your curiosity. You told me that you told us just now that sometimes we ask the doctors, yes. Because some persons feel as though I'm so experienced, I'm so professional, I have seen this life, and there's nothing that any small boy can tell me.
Okay. But that's the reality. Yeah. Because some of those slangs, I would have to ask, what does that mean? And they would, in fact, I'm learning from my patient. They are light years. They are the ones doing the act. I'm the ones reading what they are doing. And before it gets to the print, you know how many years they would have passed?
Yes.
So they will tell us the latest in town now that this is what they are selling now. So you go and write down at least I've added down one to my knowledge base. You are reading somebody's acts. Okay.
Anyway, to add to that, let me just say this conversation is giving. Did you give a comment? I just wanted to do if you are
checking Chief's vibe check.
I want to check.
Anyway, so check your language.
We've
my nomenclature.
So when it's giving, it means it's good, it's popping.
I guess I could guess it's acceptable or something. Yes. It's expected.
That's okay. That's okay.
We accept that. We're very young.
So just because we've kept you too long from your patients who you love so much, let's just end on this. 5 years from now, what do you see as progress? ISSUP Nigeria, VIBECHECK, the whole advocacy.
Okay. Progress for me is 1 million users on that VIBECHECK per year. 1 million people use it per year. That's success for me. Success for me is collaboration across several government agencies. We're working together. No more working in silos. That's that's success for me. Success for me is Ministry of Education. They start teaching life skills from primary school to secondary school. That's success for me. Success for me is more empowered, maybe NDLEA, more empowered pharmaceutical society to reduce supply of substances. That's success for me. And success for me, well, more of digital tools to help the country. It's not just about VIBECHECK is just one. We could expand it. We could. I'm looking forward. Somebody said, "What if government takes over?" I said, "Yes, I'll gladly give it to government. If or any organization that wants to work with us, I want everybody to come. It's not about me. Yeah. It's about our patients. It's about the next generation. What are we giving to them? It's not just about. It's about the next generation. Let's come together. Bring your ideas. Let's scale it. It doesn't have to be ISSUP Nigeria alone. It could be ISSUP Nigeria. What's the other organization?
Together.
Join it. What about yours?
African Club.
Yes, all of us together. Yeah. We are working together and we are promoting this. So when we all own it, you don't feel you are working for me. You are working for yourself. You are working for yourself. And the work we are doing, it shows. And the next generation, they are better for it. That's success for me.
Thank you so much, ma'am. It's been a pleasure having you.
Thank you very much.
We hope to hear from you. I hope to check back with you on that progress. Hopefully, it happens as you've expected it to.
Thank you very much.
Yes. So that's our round of this very entertaining episode of Beyond Addiction. Do join us next time. And for the meantime, you can check VIBECHECK to see how you're doing. And you can also like, share, subscribe, follow for more. See you next time. Bye for now.